Just a minute. Good afternoon, everyone. I hope I'm audible to everyone who is attending today's webinar. So today we are going to learn some basics of small animal ultrasonography, which is really a useful tool for diagnostic and some intervention purpose. We can use ultrasound for some treatment related conditions, and most of the time it's useful for the diagnosis, where not all the time other diagnostic approach are good enough to get into the point of the diagnosis. So let's start. First of all, we should understand the basic principle. What is there in the ultrasound machine? It's a monitor, probe, and all those things, how it works. We should understand properly, then only we'll understand other aspects of ultrasound imaging and further things that is really useful for diagnosis. Here we need to talk basic, because if we don't understand the basic, there is always confusion. The ultrasound and the X-ray image is completely different. Before we start, you have to take that impression out of your mind, how it looks when we take the X-ray of the dog, because ultrasound and the X-ray is completely different thing. So first we need to understand that the ultrasound is not a shadow image. X-ray, if we get the X-ray done of the animal, then we have the X-ray image. So always we need to understand that that image is shadow image. We pass the light, X-ray light, we can say, from some objects, and you will get the shadow. So that's a shadow image, but ultrasound is not a shadow image. So it's not a shadow imaging technique that we use for the X-ray. Now we need to understand, because without this, it's really confusing. Even if you know how to do, even if you know what is liver, what is kidney, what is urinary bladder, even if you can find out, if you don't understand basics, then it's really confusing. So let's start with the basic. What is ultrasound? So basically, it's a high frequency sound wave that we cannot hear. Maybe some of the animals, they have ability to hear all those sound waves. So it's basically high frequency sound wave. That is normally what we hear is below 2 kilohertz. That's a wavelength of the sound wave that we can hear from our human ear. So what we use for the medical purpose is ranging from 2 to 10 megahertz. So that's the frequency of the sound wave that we commonly use. So I hope by now everyone is a little bit aware of this frequency of the ultrasound, since I hope here today we are all some recent graduates or some final year students. So what happens, the ultrasound is generated by the probe that we use, and it travels through the object, then we get the image. So basically what we use, why I'm focusing on this is the frequency of the sound wave that we use for the diagnostic or medical purpose. So here we have to understand that there are different frequencies that we use. So later we will discuss what's the importance of different frequency. So we have, it doesn't matter either higher frequency or lower frequency, they all have their own importance. So we will discuss on that. So here you can see the wavelength. of the 3 megahertz sound wave, and this is 7.5. You can see the difference, how it travels. So regarding the principle, so we have to understand how it works. First of all, we need to understand there is one principle that is applies is piezoelectric principle. That means some pressure, kinetic or pressure or energy, that if it applies to some object, there will be the generation of electricity. So that is called piezoelectric principle. So here, why we use this on ultrasound is when we use the ultrasound machine, the probe generates the ultrasound and it reflects back and it creates the electric current. So that will eventually responsible for giving us the image of some object. So this is called the piezoelectric principle. That means some pressure can generate the electricity. So later we'll understand how it works. So first of all, what happens when we start using ultrasound? First of all, there is a electric current. Okay, so in the machine we apply the electric current, and what happens, there is a crystal on the probe. So everyone knows what is probe, that ultrasound probe that we use. We apply electric current to the crystal inside the probe. So what happens after that, the crystal starts vibrating and it generates sound wave, that is ultrasound waves. Okay, it's a high frequency sound wave. So that sound wave leaves the probe, and after that, that sound wave goes through the body, from the skin to the deeper tissue where we are trying to focus. And during that process, what happens is some of the sound wave gets reflected back to the probe, and some they goes further down. They propagate through the medium. Either it's a soft tissue or the fluid. It can be anything. It depends where we are trying to focus. So after that, I already told, at each level, either it goes through or it's reflected back. Not necessary that 100% gets reflected back. It depends upon the medium. Some of the sound wave gets reflected back and some they goes through. And after returning from the objects, that sound wave hits the crystal, okay, crystal inside the probe that we are holding. And that moment, the crystal gets again vibrated from the reflected sound wave. What happens? First, it gets vibrated after we apply the electricity, then it generates sound wave, and that sound wave leaves the probe and hit some object, and it's again returned back to the probe, and that return echo, the return sound wave, that starts vibrating the crystal. And from that vibration, what happens? That creates the current. Just now I told piezoelectric principle. That means the sound wave hits the probe crystal and that crystal gets vibrated and that generates the current. And that current is will be responsible for giving the ultrasound image on the screen. So I hope we are clear about this. We can discuss later if not. So basically this is the process what happens. So here this is the probe, and it leaves the sound wave. So it all travels all the way down to the object. And from that object, that sound wave gets reflected back. It comes all the way back to the probe. And that probe receives the reflected sound wave. And that sound wave that received by the probe is responsible to create the image. So this is how it happens. We will discuss how the image is created. So what happens that each of the returning echoes that leaves the probe, that is responsible for giving the image, that is responsible for the brightness of the image or darkness of the image. It all depends how it runs. So here we just need to understand now as this all returning echoes have discrete amplitude, and they have given the definitive location, in the image, screen image, and that will create the image of the object that we are focusing on. So here, and now today we are only discussing on there are different kind of ultrasonographic examination, like we call the motion mode, we call the 3D. So, but here we are discussing today 2D ultrasonography, that is called B mode, or it's called brightness mode. Okay. So what happens? Just now we discussed how the ultrasound wave leaves the probe and comes back to the probe, and is responsible for the image generation. So what happens? First, the ultrasound wave leaves the probe and it hits the object, right? And then it returns back to the probe, and each returning echo is assigned brightness and location. So we have to understand, because this brightness and the location is responsible for the image creation. Now we really have to understand that how image is created. Without that, we are always in confusion. So first, echo leaves the probe and it returns back to the probe. And when it returns back to the probe, depending upon the time travel by the ultrasound wave and the medium that goes through, it is given brightness and the location. So the brightness and location will be assigned depends on percentage of reflected echoes. So this is very important. Now I really want to focus on this brightness on the ultrasound, because end of the day, ultrasound is all in between black and white. There's nothing more than that. It's all in between black and white. So now we have to understand how the brightness happens, how some objects looks very bright, some looks dark. So that we need to understand, because the percentage of reflected echo, if there is a high percentage of echo reflection back to the probe, it looks bright, right? If there is a less echo returning to the probe, that means it looks more black. So that the brightness depends upon the percentage of reflected echoes, and the location depends upon the time and direction. Let's say that if the ultrasound wave leaves the probe, then it runs through the medium and it gets back. If the echo comes back from the near place, then it is given different location in the image. If the echo comes from far location, then it is given different location. So it all depends, like time travel. We call it the time travel by the ultrasound wave. If the ultrasound wave it gets returned back to the probe very shortly, then it is given one location and the image. If the ultrasound wave returns back to the probe from far, it takes time. So it's given different location. So depending upon the time of the returning echo, it's given location on the image, and that's how the image is created. So we'll understand that very soon more. And now, so here, that's how it made. So if you remember of the big hoarding board, if you are traveling on the street in the evening, you will see the big hoarding board with the image, but that image is a combination of multiple tiny dots that gives the big image. So every dot is responsible for the creating image. If you really look in a big hoarding board of one pattern, like not all kind of hoarding boards, there is some specific kind of hoarding boards. They use small dots to create the image, small dots of different colors to create the image. Same thing happens in the ultrasound. So image on the screen is a plot of all the tiny reflections that return. That means the many sound wave they leaves, and each reflected echoes, they have the specific location on the image that they come and create. So that is responsible for the image creation. And this plot is constantly refreshed. So that's how we get the real-time imaging. So that's also we will understand. Here, I'm talking about frame per second. So this is also another thing what we need to understand, because just now I mentioned the image, while image creation, ultrasound probe leaves the ultrasound wave and it hits the object and it gets back to the probe. But here, the probe that generates the ultrasound wave and that receives is the same. So that means it needs to really work fast to give you the real-time image. That means it leaves and receives. So it happens very frequently. That means it happens 25 to 50 times per second. One probe leaving, generating the ultrasound wave and receiving it back happens 25 to 50 times per second. So more the frame second, you will get the better image. If the sound wave that we creating have the probe has 25 frame per second, then that means image quality is less. If the probe is receiving and sending images, 50 images in 1 second, that means we have very high quality image. So that is really important. I'll show you one image just here for you to understand more. So here we can see this is how we see the moving image in the ultrasound. It's not a video image. It's a combination of different plots that the ultrasound skin puts everything together. Then we'll see the image. So this is, I think everyone knows how this is just the picture. This is the motion image of maybe 10-15 pictures. So like this, the machine combines the different images and gives us the real-time imaging. So this is how it works. So here, why I'm saying, I'm stressing on this is the more frame per second, the better the image. So if we have many frames in 1 second, if we have 5 frames in 1 second, we have very poor quality video. If we have 50 images per second, we have very high resolution video. So the quality of ultrasound machine depends, the image quality depends upon the frame per second. That is the one thing. There are many aspects that we see. So this is how the ultrasound machine creates the image, a video image. So now we discuss about image interpretation. So I hope by now everyone got to know a little bit. So we just need to understand one thing, that the probe generates the wave, that wave hits the object and it comes back, and that creates the image. So the probe, when it comes back, it may not come back 100%. So if it's 80% comes to the probe, then it gives brightness. If very less comes, then it is more dark. So that's just that we need to understand. So here in ultrasound image, what does it mean when it's white? So we have to understand, because I started telling you everything is in between black and white. I'm not talking about the color Doppler ultrasound and all. We're talking about the normal basic ultrasound machine. So everything is in between white and black. So what is white? White means objects that transmits, reflects waves. The white means the more echo returning back to the probe. That means the echo hits the object and it returns back many percentage of the echoes. So that normally those objects are soft tissue, muscle, fat, vessels, nodes, and other organs. So those are the objects that we see more whitish. And black. Black means objects that transmits but does not reflect waves. So it transmits, that means it goes through. It goes through that object. It from that area, even a 1% echo doesn't reflect. It goes through. So it's a one-way go. So on that, we see black. That area we see black because no echoes are returning to give us a brightness and the image. So basically that is fluid. So fluid looks black because fluid doesn't reflect sound wave. It gives the medium for the sound wave to travel through. And gray, what is gray? Gray means in between black and white. So that means some percentage of the echoes transmitting through and some reflecting back. So depending upon that percentage, we see the level of brightness. Some are really bright because they are reflecting more echoes. Some are really black because they are not reflecting that much of echoes back to the probe. So here, I think if you see this image, it's a short video image, you'll understand, because this is the real object. Here, this is the real object, and this is the ultrasound image. Just now I told the tiny plots that gives the image. That means you can see they are all dots. These are the dots. That means from this area, echoes are not returning back much. That's why it's looking black. From this area, from this ring, more echoes are returning back. That means it's giving white. So this image, so just we need to understand that this is the real image, and this is the some medium that image is staying, right? So in between also there is a medium. So this area is looking black or gray. You can say gray, that's fine. And this looks really white. So basically it's not the whole image you see. It's the plots, small plots that gives us the image of the ring. So if you see here, you can see that image. So this is how we see ultrasound image on the machine. So it's a combination of all small reflected sound waves. So now we discuss about probe selection. There are 3 types of probe. One is linear probe, one is curvilinear probe, and one is phased array, we call. This is basically used for different purpose. This probe most commonly we use for the intrathoracic examination, mostly for the cardiac evaluation, because we don't have enough space in between the intercostal muscle. So we need a very small area. What happens from here, the echo sound leaves and it covers the bigger area down here. But in this probe, it already have the big area when it starts. So it's not suitable for the chest cavity evaluation. And this is basically for the superficial organ evaluation that we use. So here, this probe has the high frequency. So we'll talk about the frequency, also how we select that. So these are the 3 common probes that we use. So this linear probe is basically for superficial organs. This curvilinear is for abdominal cavity scanning. And this phased array probe is for heart evaluation and chest cavity scanning, because it has very small point that generates sound wave, but later it covers the big area. So we can work through the very small space between the 2 ribs. So now we have to understand probe frequencies. So that probe frequency determines the optimal depth of penetration. So now this is really important while selecting probe frequency. So basically what we need to understand that the standard probe frequency that we work, most of the time that it starts at the level of 5 megahertz. From that, either we go up or we come down. So that is the basic overall that it's suitable for every condition. So higher frequency, that means frequency more than 5 megahertz. What happens that it has deeper penetration. So it goes very deep. I mean, it doesn't go the deep. Why? It loses the energy faster. So more the frequency, the sound wave that has low frequency, that have high penetration actually. So here, if it is more than 5, what happens? that means very high frequency. The wavelength is high frequency is wavelength. Everyone knows is a short, right? So it has less penetration. So why is that penetration? It loses the energy faster. And good thing is it has high image resolution. The image looks really good, but it doesn't transmit deep. So normally what we need to understand is, if we select the probe frequency high, that means it only gives the better image of the superficial objects. So as I said, it's better for the short depth. So the lower frequency means if it's less than 5. If we are really focusing on the deeply seated organs inside the abdomen, we have to go lower frequency. So more depth of penetration, but another thing is it doesn't have the better resolution. Image may not look good, but it has a better penetration. So this is the thing what we need to understand. In the image curation, higher the frequency, lesser the penetration, and better the resolution. So it penetrates less. It only gives us the superficial objects, image of the superficial objects, but we are not able to see deeply seated organs. For that, we have to really use less frequency. But again, there is some techniques, because if we use low frequency, the image quality is not good. So these things we have to manage. Now we will discuss the indicator. This is also really important. If we don't know the orientation of the image, it's difficult to understand. So here, this indicator, it resembles this point on the screen. So every screen has that one indicator. That means the image is from this side of the probe. So marker probe and the image screen, that we have to understand. Otherwise, we lose our orientation. If we lose the orientation, then it's difficult to understand. So normally, just understand that there is one marker on the probe that resembles one side of the screen. Most of the time, it's a left side. Some ultrasound machine, they have a right side, but basically it's on the left side. So this marker resembles the left side of the ultrasound image on the screen. So these things, it's really difficult to understand if you don't see the machine at the same time. Just for the knowledge, I'm just mentioning this. The depth, we can adjust the depth of the image on the machine. That means if we just want to see the superficial part, we can set the depth very less. If we want to see the deeply seated organs, we can set the depth more, then it's easy to see the deeply seated organs. Now the gain means, I'm just trying to explain few things, because there are many things, but if we do all at once, it's really confusing. Another thing we need to understand is gain. Gain is the brightness of the image. So if we increase the brightness, that doesn't mean that the image looks nice, because the gain, if you try to maintain low, the image looks nice, because that gain is more disturbance actually, but it makes your image bright, but it's not good. So you have to do the ultrasound in completely dark room and try to minimize the gain as much less as you can, because lower the gain, you have clear image. If you increase the gain, the image looks white, but it's not that clear. So we have to understand that the importance of the gain. Sometimes we need to, if we are doing ultrasound in very bright area, you have to increase the gain to see it, but it makes the image a little bit not clear. So another is time gain compensation. So it's something that we adjust on the machine to get the proper image. So I'm just skipping that. So this is the basic ultrasound machine control panels. So here, this is B mode that we today discussing. This is gain button that increase the brightness of the image. This is the depth button. So you just need to see first, not all the machines have the same settings. It may be different. Just you need to understand that there is these things that is really important. So this is the freeze button. That means if we need to freeze the image and do the measurement, then we need to use this button, because on the moving image we cannot do the measurement of the organs. So this button is to freeze the image that we are looking, and this is for this is called trackball or trackpad to facilitate the other different types of work we do on the still image. So now this is just basic I'm discussing. So I don't think you have to really try to give more focus on this right now. We once we have the machine, then we can just see and try to understand more. So this is really important. Basically, we are talking this for the right-handed person, how we can make the things easy. So normally we have to put the animal on our right side, and we have to face the head of the dog or cat or the animal, and the ultrasound machine should be on the left side. So we have to have left hand free to control the machine, and right hand to hold the probe. So we have to keep the animal on our right side. So we have to face the head of the animal. So that is the most easiest way that we can keep the animal for our easy handling. And mostly for most of the examination, ultrasonographic abdominal examination, we put animal on the dorsal recumbency. So here I'm talking more about the small animal. I'm not talking about the large animal. Dorsal recumbency and lateral also sometimes, but it's not really preferred. And we can do sometimes on the standing position if the patient is really, really big. So these are the basic things that we understand. So this is the exactly how we need to do, so that we have really comfortable position. If we are not comfortable, it's difficult to do the proper scanning. So on our right side, the animal, we have to face the head of the animal, and on our left, we should have the ultrasound machine, and our left hand can control the machine, and the right hand, we can hold the probe. So this is the really commonly used position. And first we have to understand that preparation also really important. Without proper preparation, we may not get the good image. Normally we really need to save the body, but sometimes it's emergency. In case of emergency, we use the alcohol and spray on the body, and we directly do the ultrasound. That is different. But when it's not emergency, we really need to clip the hair. And like human, we should have bladder, moderately filled urinary bladder. Otherwise, it's difficult to track some organs. Not all, there are some organs, it's difficult. And another thing is, if we have V-shaped padded table, that is better, so that we can have the animal in proper aligned position. And dorsal recumbency, as I told, and someone has to hold the limb. If it's too aggressive, we can use the anesthesia also sometimes. So this is how we normally position. So if we have this sort of thing, it's really good, because if we position normally, it's really good to locate the organs. So these things really matters. It's not a big thing, but it matters a lot. So positioning also really one thing that we need to understand. So by now, I hope we understood a little bit of things. I don't expect everyone to be expert in 1 hour, but at least if you feel a little bit different after the end of this session, that will be really useful. So first of all, what we have to understand while doing abdominal ultrasound is probe placement, organ identification. Another thing, first we need to understand how we place the probe. Like if we don't know how to hold the pen, we cannot write. It's the same goes with this. So there is some techniques that we need to understand. And we need to understand that organ identification, because without identification, we won't be able to do anything. And we have to understand the location of the organs in the abdominal cavity and the organ measurements. And another thing is comparative echogenicity. Just now I told that everything is between black and white. So this echogenicity also is a range of whiteness and darkness. So this is really useful to understand the status of the organ, because we compare and assessing pathological conditions. So these things we keep in mind while doing abdominal ultrasound. First, we need to understand probe placement. So these are the motions. I will show how it works. Okay, it's really easy. It's nothing actually, but it's something. It's given the name. It's just how we rotate, how we tilt, how we slide the probe. It's just the name given, right? So here we need to understand there is a 4 different motion. So this is called the sliding motion. That means how we are sliding the probe, right? This is sliding. Left, right, up, down. That's called sliding. And this is the one what we are seeing is, that means the probe is going from one point to another point, right? But in number 2, the probe is not going from one point to another point. It's just scanning from the same point, just changing the angle, right? So this is called fanning, like how we use fan. Fan is always on the one point, right? So this is the first probe motion, means it leaves the place, and the second is it doesn't leave, it's just tilting. And the third, this is the rotation, right? So we can rotate, because it is not the X-ray image I told earlier. It is a cross-sectional image, because at one point sound wave sections the object and it gives the image. So if we are sectioning on this point, we get one image, and if we are sectioning on this, we get different image. So this rotation also is very useful. And another is rocking. It's also the same. This one and this one is the same, but in different angle. So it's just a name given to the different motions. Excuse me. So basically, these are the motions we apply while doing ultrasound. Is just only sliding is not enough to get the proper image. So it depends upon the different conditions. So this is how the image changes. So another is compression. Just now I mentioned, if you remember, the deeper the object, we have to set low frequency, because it needs to go down. But if we set low frequency, the sound wave doesn't give a good image. So what we can do, we can compress, right? If we are doing abdominal ultrasound, if we compress, then it goes, the distance gets short. If the long distance is there, we cannot get better image. So if we compress, then the distance gets short and you will get the better image with the higher frequency. So how it goes, you can see, like compression, see? This compression, you can see that the down image is coming up with just the compression. So this is how we get better image, just compressing. So you have to compress. Sometimes animal may not be comfortable, but in some cases we can compress and we have the better image. So you can see with the same frequency and the same probe setting, the down image is coming up because it's compressing. So compression also really useful technique when we are examining deeper and deeply seated organs. Of course, it's not possible in case of thorax, but abdominal cavity, we can compress and minimize the distance and get the better image. So this thing we really need to understand, because without understanding the organ location, it's difficult to understand that how we locate the organs. So here, this is the chest cavity. Okay, this is the rib. So here is gallbladder. This is the liver, and this is here. This is stomach, and this is the left side. So this is left. This is right. So on the left side we have the spleen, and there right near the spleen is the left kidney, and here down we get the urinary bladder. And if we go this side, this is the intestines. So and then we get the right kidney. Right kidney is a bit higher as compared to the left kidney. Then we come here to the liver. So basically liver, spleen, kidney, and urinary bladder, these are the most important organs that we normally focus on while doing the abdominal ultrasound. So now we have to understand that these terms. Without understanding these terms, it's really difficult to put things in proper order. So hyperechoic means more white, right? More echogenic. Hypoechoic means less. So this hyper and hypoechoic and this isoechoic, that means same echogenicity. So these things you cannot say without comparison, right? Let's say this is hyperechoic, means you have to compare with some organs, some other organs. You cannot say the kidney is hyperechoic without comparing with other organ. And another is anechoic. Anechoic means no echogenicity. That means completely black. Hyperechoic, more white. Hypoechoic, less white. Isoechoic means two object looks the same. And anechoic means more black. So here, if we see, this area is anechoic, and this area is hyperechoic, and this area we can say that they are isoechoic, means they have the same brightness, right? This area and this area, we can call them isoechoic, means same brightness, and this is really black. So this one we can say anechoic, means no echogenicity, completely black. And this area is hyperechoic as compared to this area, right? Because you cannot say hyperechoic without comparison. Just we need to understand that we need to compare. Anechoic, you can say, if it's completely black, you don't need to compare black with the white. Complete black means complete black. So that we can say anechoic, but isoechoic, hypoechoic, hyperechoic, we have to compare. This area is hyperechoic as compared to this area. This area is hypoechoic as compared to this area. And if the two area is same brightness, then we can say isoechoic. So these are the terms most commonly used to describe the ultrasound findings. So we have to know this. We cannot say it looks brighter. So now this is really important. We have to understand this. Without understanding this, even if you know this is kidney, this is liver, this is really not useful, right? So now you understand how the black and white, how it happens. So what happens to the ultrasound wave when it hits air? What happens? The ultrasound wave, when it hits air in the body, what happens? There is some event. So the completely reflected back to the probe, right? The ultrasound wave, when it hits air, it reflects back to the probe. There is no propagation. The air blocks the sound wave. But the problem is, when it hits the air, when it comes back, it again hits the another air, then sometimes what happens, it gets reflected. in same area. So there is an artifact called reverberation artifact that happens when there is air. That's why we call air is the enemy. We don't want air when we do the ultrasound because it disturbs the image. It not only reflects, it disturbs. If you, everyone knows when you go to the on the top of the mountain and there is a jungle, if you say hello, it reflects back many times. So that means when it echo hits the air, it gets reflected and again reflected back and again reflects in the limited area of the air, then there is a disturbance. So this disturbance that causes the artifact and the image gets disturbed. Other image also gets disturbed. So we don't want air, either on the stomach or in between the probe and the skin. We don't want air. That's why we use gel, because we don't want air in between the skin and the probe, and not even inside the stomach. That air also disturbs our image. So we say that when we need to do ultrasound, empty stomach, and they can have water. If you eat or if the dog eats, then what happens? It starts producing air because the food starts getting digested and there is a lot of disturbance. So that's the reason why we say that. So what happens to the ultrasound wave when it hits fluid? So by now, I think everyone knows, because when it goes through the fluid, it doesn't come back. The ultrasound wave doesn't get reflected back to the probe. It propagates through, so it doesn't give any image. So if it doesn't give any image, that means it's black. No image means black. So black, because 100% of the sound wave passes through the fluid medium. It doesn't reflect back. So that's why this is the urinary bladder. This is the black, all black, right? So this is the edge of the urinary bladder. So it looks all black because there is no echo returning back to the probe that gives image. So this black is no image. But for us, no image also of image, because it gives the image to us. That's how it works. And just from the beginning, I'm saying it's between black and white. So this is completely black, means there is a fluid. There is a very, it's not a, sometimes if the fluid is thick or turbid, it's not completely black. So that's also we need to understand. That means black means from this area. Let's say the sound wave is coming from here, coming, some part is returning back and giving this image. Some sound wave is returning back and giving this image. From here also some sound wave returning back to the probe and giving this image. And sound wave, when it comes here, it doesn't go back. It runs through. It is going down, down, down here. That's why this area is black, because this area is not reflecting and there is no image. No image, black. And it hits this wall of the bladder and it starts again reflecting back and it's giving this sort of image. So this is how it happens when sound wave goes through the fluid. So now what happens when it goes through the bone? So by now everyone knows it's white, right? But no, you won't see the white bone, because to see the bone, the sound wave need to pass to the diameter of the bone. It doesn't pass through the diameter of the bone, because from the edge itself, wave gets reflected. So it doesn't make the full image of the bone. So what happens? White leading edge, then shadow. That means total reflection. So we won't see the full image of the bone. If this is the cross-section of the bone, we don't see the full image. We just see the edge, because from this edge, no sound wave is going through. If it is not going down, it's not making any image. So now you can see here, this is the surface of the rib. But rib is not of this size. Maybe rib is of this size, all this size. So what happens? This is just the surface, because from the surface itself, sound wave gets reflected. It cannot make image further down. And then you will see the black shadow, because there is no image down. First the edge and the black shadow. That means from that level, no sound wave are going through down. Then you will see the black shadow all the way down. And this is also shadow. First, you see the edge, and then you see the shadow. You don't expect to see the bone like you see in the X-ray image, because X-ray image, it has a full shadow, but this ultrasound is a reflection image of the ultrasound wave. So you just see the edge of the bone and the shadow from down. So this is how it creates the image. So what happens when it hits the soft tissue? It's simple, either black or white or gray. So it's different depending upon the density of the object. So this is the image of the liver. So here you can see this is the diaphragm. It is very highly reflective, so you can see white. And this is the vein running inside the liver. This is the longitudinal section, and this is the cross-sectional of the liver vessels that we see. And this is down here, this white is the diaphragm, and this is the liver parenchyma, all you see. So this image is, we call the gray. It's a gray brightness when we talk about the brightness. So this is all what it is. So basically ultrasound is the section image, not the full shadow image, right? And here you see the spleen up here, and this is the kidney, left kidney, and the spleen. So this is all you see, different things, like this is black here, maybe a little bit of abdominal fluid, and this is black. So this black is the blood. So blood also is a fluid, so that should look black. And this is the vein, and this is black because there is urine inside the kidney. So this is the cortex of the kidney. It's a renal cortex, and this is the medullary area, and inside you see the black. So that is how it creates the image. So now soft tissue, it's either white, gray, or black. Sometimes different brightness we see. So this is how it creates the image. So here I told that fluid, when it this is just one dog we just did yesterday. Here you can see the urinary bladder, right? This is all black because this is urine. But this is the uterus containing pus, right? This is the pus also fluid, but you can see how the brightness, little bit of brightness here, because it's a thick, pus is really thick, the urine is thin. So this looks really black. I mean, there is nothing more black than this. But here, if you compare the urine inside the urinary bladder and the pus inside the uterus, you can see the difference in the brightness, right? There is a clear difference. So by now we need to understand everything is relative. When we do the ultrasound, don't try to keep in mind that, oh, kidney look this bright. No, you always have to compare. You have to compare kidney with liver. You have to compare liver with spleen. So all the time it's a comparison. So don't really put focus on what is the brightness. Just try to see the structure. Try to understand the structure of the organ. So brightness you can compare all the time and see. It's not a hard and fast. It depends upon the gain you maintain and all other aspects. So as I mentioned, that all comparative echogenicity that we see. So this is all I'm talking about, from hypoechoic to hyperechoic. From black, I mean, I can say anechoic, from black to the white. So there is no echogenicity in the urine and bile inside the gallbladder. After that, muscle, renal medulla, renal cortex, liver, fat, and spleen, prostate, and the renal sinus, because inside the kidney there is different echogenicity. You can see some black, some really white, and some gray. So you can see here renal medulla is more black than renal cortex. Renal cortex is more black than renal sinus. That means renal sinus is more white than the renal cortex. So these are the things what we need to understand. And vessel walls looks really white because they have the tissues that that's really high density tissue. And bone and gas. So gas also looks white because it reflects the sound wave. It doesn't let the sound wave go through. And bone I just discussed. So here I'll show you the image. This is a spleen. So normally spleen is really superficially seated. It's very just below. This is the skin level. So I told you earlier that in the ultrasound, the image that comes on the top is the superficial, and that comes on the down is the deep ones, right? So this is the skin, and this is the muscle and some tissues, and right after that you can see spleen. So it's very superficial because spleen stays very superficial. So this is this white line you can see. This is the covering that we have on the spleen. And this is the spleen parenchyma. See how smooth. Spleen, they don't have, in spleen there is no, not much of blood supply, and the veins like in liver. So this you can see very smooth. This is how the spleen texture looks like. And another is kidney. So now you can see here also not much of distance between the kidney and the skin, because if we really compress, we have the very less distance. So to have the proper image, we can put the pressure and minimize the distance. So here, this is the kidney. This is the outer cortex, right? And this is the renal pelvis that looks really white. It contains fat and other tissues. And these black areas are the urine collected areas, where the urine gets collected, and this collected urine gets drained out through the hilus area of the kidney. And this is the normal kidney structure. You can see that echogenicity, how it varies even inside the one organ. This is black, this is white. So basically this black, this white, this black is the one giving the image of the kidney. So that's how it is, it works. And the liver is variable. So you see gallbladder, you see normal parenchyma, you see diaphragm near the liver, and all these are the vessels. That is the cross-sectional view of the vessels. This is the gallbladder. So this is down white. This you can see the diaphragm. So these are the structure we see. So now today we are more focusing on how image created and why it looks black, why it looks white, why some part looks only one line, and all the things I hope we did understand by now. Of course, we cannot expect to be expert in 1 hour, but at least if we feel a little bit of difference after end of this session, I'll be really happy. So here, I'd like to say, here you can see the comparison, even you seeing the image. So here, this is the spleen. Up here, this is the spleen, and it looks very white, right? Because spleen looks more whiter than the kidney. Down here is the kidney. This is the cross-sectional view, not the longitudinal view. So here, this is also the kidney. Here you can see, and this is the liver. So most of the time, before telling that there is some pathology, so if there is hepatitis, if there is a liver cirrhosis, liver looks more whitish as compared to the normal ones. So normally spleen looks more whitish than the liver. So let's say if we compare spleen and the liver looks more white in comparison with the spleen, then we can say there is something wrong. So these things we always need to do comparison. So earlier I mentioned how we compare. So here you can see spleen is more white, then less white is liver, and the less white is kidney cortex, right? So this kidney cortex is more black, and more white is liver. So this is the how it happens. This is the pattern. So we have to understand spleen is hyperechoic to liver, liver is hyperechoic to kidney cortex, kidney cortex is hypoechoic to liver parenchyma, and liver parenchyma is hypoechoic to spleen parenchyma. So this is the really most commonly used comparison. So at least we need to understand this. Today you can just memorize this thing. So that's how all the organ imaging works. So from the beginning, I've been telling everything in between black and white. So we are the one to understand what is right, what is not right. Thank you.
Thank you, sir, for your presentation. If anybody has any questions, then they can unmute themselves and ask.